Welcome to Northern Soul. Today we're going to be discussing twisted knees. So we're going to be using kinesiology tape in order to tape and support any sort of twisted knee. So whether it's external rotation or internal rotation or outward or inward, I'll show you the individual taping for that, and also in combination how you can combine them. So let's get started. The thing about the knee, this thing can be combined with other knee tapings as well. So if you have any sort of cruciate ligament or collateral ligament or any of that sort of stuff where you need additional taping, you can do that taping first and then add this taping that I'm about to show you afterwards. So let's get to it. So if we want to, I'm going to show you first outward rotation support. So if you want to, this is for limiting inward rotation. So if you got a twisted knee and it hurts to rotate your knee inward, so if you're moving your foot towards the inside, then and you have this acute pain in the knee, then this is the taping that you're going to want to do, and this will actually limit how much inward rotation you'll do by reinforcing outward rotation. So let's get started. You can double up on this stuff, so you can use either a single tape, or if you need more support, or when you have enough tape with you, then a second roll adjacent to the first roll is what you would do. And external, or the other taping that I'm going to show you, which is internal rotation, will be the exact opposite of this one. But I will show you so that at least you can see it. Some people obviously are visual learners and they'd like to see that kind of stuff. So I'm going to get to it. Sorry if I'm shouting. Okay, so the first part we need to do is you're going to be on like a stool. Typically I'm not going to be on a stool because in this case I'm just going to show you. That way, I have access to my whole leg here. And if you're pretty furry, then you might wish to shave, use a trimmer or whatever to get rid of excess hair in order to help with the adhesion. I'm not going to do that because I don't have twisted knees and stuff, and really I never do that because I find the tape sticks on me anyway. But you may find that if the tape doesn't stick on you for whatever reason, clean the area up and you might need to shave. Okay, good. Otherwise you won't have to deal with all that peeling and stuff afterwards where you're pretty much waxing yourself. So tips to get started. Okay. So first thing we want to do, and it doesn't matter obviously which leg it is, as long as so this is my right leg facing towards you, and what I'm going to do is rotate my foot outward. So I'm going to do outward rotation like this, and then I'm going to measure. Okay, so to measure, we're going to do the base, the anchor point is behind the knee, so we need to have half and half kind of thing with the taping. So I'm just going to start with behind the knee, and then we're going to actually aim it towards the shin. Now there's going to be considerable stretch here, and then the next part's going to go over the thigh. So I'm just going to measure that, and then I'm going to shorten it by a bit because it's a massive tape, and since there's going to be considerable stretch, then I don't want to get too carried away on the taping, because tape conservation is part of the game for some people. If you've got 4,000 rolls and you really don't care, then don't worry too much about it. Alright, here we go. So just under the knee, so I'm going to have to break that in the middle. And there's going to be zero stretch on the anchor. So I'm just going to crimp those two bits. You split the tape, then you're going to we're going to aim behind the knee with the outward rotation of the foot. Then what you're going to do is you're going to have the outside of the tape, the one that's aimed on the outside of your body, is going to be aimed down, and then the inside of the taping is going to be aimed up, because that's going to be aimed towards your thigh for taping. Okay, so external rotation of the foot. Just going to, with no stretch, right in the back of the knee, aiming down slightly, I'm going to grab the outside part of the tape, the one that's aimed on the outside of my body. There we go, crimp that. And then with considerable stretch, so we're talking about 70% stretch, you're going to aim that along the shin, across the shin area. So just like that. It's going to be no stretch on the end. Now we're going to check out you can always rub that in, make sure it's adhered. There we go. I'm going to grab the inside tape there with still external rotation. I'm going to add considerable stretch, and then I'm going to bring it across the thigh. Just like that. So 70% stretch across the thigh like that. Once you reach the end, no stretch. And you can go ahead and rub that in. Alright, so that'll help resist inward rotation. So if you try to go in, it'll start to pull on it. So it's also good as a mental cue to kind of tell you, hey, you're internally rotating your hip. Usually you'll, if you have pain, you'll know that, but you're trying to help limit the pain. Now, usually one's not going to be enough. For me, I would add a second strip. But for those of you that have really messed up knees and might have like damaged ligaments and stuff, where you really need to immobilize the knee itself, you're going to want to combine this with the next taping that I'm going to show you, or you can use it individually. Now I'll use a different color so that you can see the contrast. So this is going to represent inward rotation issue. So we want to promote outward rotation and not inward rotation. So it's the direct opposite of what we've seen here. So for taping, well, what we'll want to do is, once it'll still be sort of in the middle, so we'll have one coming across here and then one coming across the opposite way. So we'll measure with the middle will be the base layer, so that's behind the knee with no stretch again. Okay, so it's opposite way. So I'm going to have the outer side of the tape aimed up. Hopefully you can see that. And that'll come across the thigh over here. So I'll measure that. And then that part will go across the shin at the bottom. So that's my measurement. I'm going to trim that, shorten that a bit, probably by an 1/8 or so, because of the considerable stretch I'm going to be adding to it. So it's going to be quite a bit more longer than the cut once applied. Just rounding off the ends, make it nice and neat. As well, it's less prone to catching. And this you don't have to use it in combination, just to make sure that's clear. So if you have any sort of issues where you have pain on, which would be internal rotation, then you want to promote outward rotation in this case. So, or if it's just really like loose and that sort of thing. So even osteoarthritis and stuff like that can add that sort of problem in later life. Okay, so you're going to have aimed up like that. So I'm going to crack that in the middle, break the tape, middle point, peel that back. I don't want to be touching the adhesive, so I'm going to be using the backing as a place to touch. Now this is an anchor point behind the knee, so it's going to be no stretch. I know I'm kind of like saying stuff 80 times over, but I want to make sure it's clear. Okay, so this one is going to be, outward rotation is going to be aimed up on the tape, and the inside of the tape is going to be aimed down. So then no stretch, back of the knee, and then what I want to do with the foot is do internal rotation. So you're just going to turn the foot in like that. So I'm going to apply right now, and then I'm going to deal with the thigh first. So with internal rotation applied, I'm going to add that considerable stretch, 70% stretch across the thigh, 75. It's going to be up there, let's put it that way, as long as your skin can handle it. And then we're going to go at the bottom here, grab the inside tape, considerable stretch again. You might even go up to like 80-90% depending on how so I'm going to do my internal rotation, how forgiving the tape is on the skin. There we go. So I'm just going to rub that in, make sure it's sticking. It takes a good 10-15 minutes before the adhesive really starts to stick onto the body. And it takes about an hour for it before it's recommended then you can go to the shower and get all sweaty and stuff like that. So just keep that in mind. So that's that taping. Now you can combine it just like as I did. If you had real knee issues and you're trying to immobilize inward and outward rotation, so you're trying to provide extra stability. So individually as well, I'm going to show you that this is the combination, what it looks like, but individually you could also add an extra strip for strength. So if I add another blue, let's say, I'm just going to reinforce the original one. Now if you only did the one outward rotation or inward rotation, you could do double strip just straight away, but I'm going to show you the combination for if you wanted to kind of support the knee more. So you just follow along, again, same idea, shorten it, and you'll see when it's done, you'll see how it'll have a massive amount of support for the knee, especially if it's really loose and you just had like a few injuries or you're recovering. It uses quite a bit of tape, but I mean, this is for those of you that are out there doing activities with loose knees, there's no getting around it, right? Oops. So I wanted to split that in the middle. There we go. Just like that. So this one's the original one where I'm going to do outward rotation of the knee, 0% stretch. I'm going to just attach that to the back again. And okay, we're going to have, yeah, internal, the inside's going to be higher and the outside's going to be lower. So this is just copying the original one. Now I'm just going to be about half a tape below. Now behind the knee, they're actually stacked on top of each other. There's no deviation from where they are. So I'm just going to do considerable stretch, outward rotation, and I'm about half a tape down from the original. Because the adhesive doesn't really like to stick to itself. That's way long. So you want to make sure you get it on the skin, if at all possible. So considerable stretch again, right across the front, no stretch on the ends, and I'm totally fluffing that. I decided to get all bunched up. Thanks, tape. There we go. So just rub that in. Okay, and then one more tape we're going to reiterate. This would be the super advanced combo, immobilize, and then we're done. So right there, and then shorten it. There we go. Round the ends off. Okay, so inside's going to be aimed down and outside's going to be aimed up, and I'm going to do internal rotation of the foot. So taking my foot there, internally rotating it, split that in the middle, right over the other tapes in the back of the knee with 0% stretch. So I'm going to aim on the outside tape's going to be aimed up, and inside tape's going to be aimed down. And then I'm going to do half, so just so I can get into the camera view here, like that, considerable stretch, 70 to 80, do half tape, just like that. Remember, no stretch on the ends. And I'm going to check out the bottom part of the taping, right here. That's internal rotation, stretch, 70%, 80% stretch. Right there. Rub that in. And that's what it looks like. So there's a massive, so I'm straightening out my leg now, so you were in a seated position, and you can see the strain on the tape as it just really, try to rotate my leg here. Yeah, there's a lot of support. You can feel a ton of support. This cross fiber support is massive, and then right through here there's a massive amount of support I can feel through there. That's that's very good. Yep. So that's what that looks like. I'll show you around the back. You can see the overlap. This is 0 stretch. Just go over top of each other. In the back of the knee. And my tapes are a little long, but I'd rather go long than too short. And that's what it looks like. You can keep that on for usually up to 7 days. And remember, if you're going to add other taping to it, do that prior and then do this one on top. Hopefully that helps. If that, I know it's probably a longer one, but if you found that helpful, please like, or if you found that entertaining, please give us a like and subscribe. Also, there's going to be lots more other knee tapings available on the Northern Soul channel, so look for that and think about subscribing if you haven't. And I'll see you on the next one. So good health to everybody, and I'll see you on the next Northern Soul video.